In this podcast episode, Stephen Bartlett interviews Dr. Daniel Amen, a leading expert on the brain and the founder of the Amen Clinics. Dr. Amen begins by explaining the importance of caring for the brain, as it is involved in everything we do. He discusses various factors that can negatively impact the brain, such as drugs, alcohol, lack of sleep, sugar, and excessive use of social media. He emphasizes that these factors can lead to obesity, decreased brain function, and mental health disorders. Dr. Amen then reveals that he has scanned over 250,000 brains, including that of Bartlett. He explains that he never makes a diagnosis based solely on a brain scan, but rather considers all the information gathered, including questionnaires and tests. He mentions that Bartlett's brain scan shows some abnormalities, such as decreased activity in the prefrontal cortex and the temporal lobes, which may be related to ADHD symptoms. The discussion then delves into the topic of ADHD. Dr. Amen explains that ADHD is not just a mental disorder but a brain disorder. He suggests that ADHD may be hereditary and asks Bartlett about his family history of ADHD. He also mentions that individuals with ADHD often struggle with organization, focus, and impulsivity. Dr. Amen then presents the brain scans of a healthy brain, showing full, even, and symmetrical activity. He compares these scans to Bartlett's brain scan, which shows some irregularities, such as decreased blood flow and a diamond pattern. He suggests that these irregularities may be due to past emotional trauma and head injuries from playing soccer. The conversation shifts to the topic of brain health and ways to improve it. Dr. Amen advises avoiding factors that can worsen brain health, such as caffeine, toxins, and head trauma. He recommends increasing blood flow to the brain through exercise, supplements like ginkgo biloba, and consuming foods like beets, oregano, rosemary, and cinnamon. Dr. Amen also discusses the importance of reducing inflammation in the brain. He mentions that low omega-3 fatty acid levels and gum disease can increase inflammation. He advises taking omega-3 supplements and maintaining good oral hygiene to reduce inflammation. The podcast then explores the impact of mental health on brain health. Dr. Amen explains that conditions like depression can increase the risk of developing dementia. He emphasizes the importance of addressing mental health issues and treating them appropriately. The conversation continues with a discussion on medication for ADHD. Dr. Amen acknowledges that medication is not for everyone and that individuals should weigh the pros and cons before making a decision. He suggests that medication can be beneficial for optimizing brain function in some cases. The conversation continues with a discussion about the impact of ADHD on individuals. Dr. Amen explains that people with severe ADHD often face exclusion and shame due to their inability to be relied upon. He emphasizes that ADHD is a brain condition and is primarily genetic. However, he also mentions that head trauma can be a possible cause in some cases. Dr. Amen explains that ADHD is not a defect but a difference in brain function. He compares it to wearing glasses for better vision. Taking medication for ADHD, such as Ritalin, can activate certain parts of the brain, such as the cerebellum and prefrontal cortex, and provide better energy and focus. The conversation then shifts to the topic of brain scanning and its role in understanding brain function. Dr. Amen shares a personal story about a patient with ADHD who had a significant improvement in her life after seeing her brain scan results. He explains that brain scans can reveal the activation or deactivation of specific brain regions and help understand the underlying causes of mental health issues. Dr. Amen introduces the concept of killing the ants, which refers to eliminating negative thoughts. He explains that negative thoughts trigger the release of chemicals in the brain that make a person feel bad. By challenging and replacing negative thoughts with positive ones, individuals can change the chemical reactions in their brains and improve their mental well-being. The conversation then delves into the impact of stress on the brain. Dr. Amen explains that chronic and unremitting stress can lead to the release of cortisol, a stress hormone, which can shrink the activity in the hippocampus, a brain region responsible for memory and learning. He also discusses the role of trauma in brain function and how traumatic experiences can affect brain activity. The discussion touches on the importance of brain reserve, which refers to the overall health of the brain before experiencing trauma. Dr. Amen explains that factors such as prenatal drug use, parental conflicts, and chronic stress can decrease brain reserve, making individuals more vulnerable to mental health issues. The conversation then explores the topic of psychopathy and its impact on brain function. Dr. Amen shares that psychopaths often have low frontal lobe function, which is associated with judgment, forethought, and impulse control. He also mentions that he has scanned the brains of psychopaths and observed troubled brain patterns. The conversation takes a turn towards discussing the potential of brain scanning in predicting the behavior and mental health of individuals, including presidential candidates. Dr. Amen suggests that brain scanning could provide valuable insights into a person's brain health and help assess their suitability for certain roles. Next, they discuss the impact of diet on brain health. Dr. Amen emphasizes the importance of a healthy diet, particularly for individuals with ADHD. He recommends avoiding processed foods, sugar, and artificial additives, and instead focusing on whole foods, lean proteins, and healthy fats. He also highlights the role of gut health and brain function and suggests incorporating probiotics and prebiotics into the diet. Exercise is another important factor in brain health, according to Dr. Amen. He explains that physical activity increases blood flow to the brain, promotes the release of feel-good chemicals, and improves cognitive function. He recommends incorporating regular exercise into daily routines, even if it's just walking. Sleep is also crucial for brain health, as Dr. Amen explains. He discusses the importance of deep sleep and how it allows the brain to clean and refresh itself. He also mentions the role of sleep apnea in increasing the risk of Alzheimer's disease and emphasizes the need to treat it. The conversation then turns to screen time and its impact on the brain. Dr. Amen explains that excessive screen time can wear out the brain's pleasure centers and increase the risk of anxiety, depression, addiction, obesity, and ADHD. He advises limiting screen time and being mindful of the content consumed. Happiness is the final topic discussed in the podcast. Dr. Amen shares his perspective on happiness, stating that it is a moral obligation and that working on oneself is the most loving thing one can do for others. He emphasizes the importance of cultivating happiness through gratitude and positive thinking. Thanks for watching. If you enjoyed the video, please like and subscribe.